The topic we are going to discuss is rubber dam. Now, the rubber dam was first of all introduced by Barnum, a New York dentist, in 1863. Now, it is important for your entrance exam. It was first introduced by Barnum in year 1863. Now, it is known as raincoat for the teeth. It improves the accessibility, visibility, gives clean and dry aseptic field. Now another MCQ that can be asked is it is contraindicated in asthmatic patients, mouth breathers and third molar cases. So important for your entrance exam, it is contraindicated in asthmatic patients, mouth breathers and third molar cases. Now, what are the advantages of using a rubber dam? Now, it is simply a raincoat for the teeth. It helps in improving the accessibility and the visibility of the working area. So, it protects the lips, cheeks and tongue. It avoids unnecessary contamination and protects patient from inhalation or ingestion. So, it keeps the teeth saliva free. Now, what are the disadvantages of using a rubber dam? Now, it takes time to apply. Communication to the patient can be difficult. Incorrect use may cause damage to the porcelain crowns, margins. Clamps can be swallowed or aspirated. Now, what are the contraindication for use of rubber dam? It is contraindicated in asthmatic patients, those who have allergy to the latex. Now, patients with allergy to the latex are the contraindication for use of rubber dam. It is contraindicated in mouth breathers, extremely malpositioned teeth or third molar. So, what does the rubber dam equipment consist of? It consists of sheet, clamp, forceps, frame and the punch. So these are the 5 things. Now let us discuss one by one. First is the rubber dam sheet. It is normally available in size of 5:5 or 6:6 square in green or black color. Now what is the normally available size for rubber dam sheet? It is 5:5 or 6:6 squares. So that is important for your entrance exam. Now it is available in 3 thickness. The first is light, medium or heavy thickness. Can be Now these are the rubber dam sheets you can see. Now remember, the sheet has a dull and a shiny surface. The dull surface is placed facing the operator. Now you can get another MCQ. The dull surface is placed facing the operator. Dull area is less reflective, whereas shiny area is more reflective. So dull side is placed facing the operator. Now thicker dam is effective in retracting the tissue and is more resistant to tearing. So which dam you will prefer? You will prefer a thicker rubber dam that is more resistant to tearing. So it is indicated for isolation in case with the class 5 lesions. Now what is the thickness of rubber dam sheet? You can get an MCQ. It is available in thick, medium, heavy, extra heavy or special heavy. Now what will be their thickness? 0.515 for the thin, 0.2 for the medium, 0.25 for the heavy. Extra heavy is 0.30 and special heavy is 0.35. So another MCQ that can be asked is heavy thickness with thickness of 0.25. A heavy rubber dam sheet has a thickness of 0.25 mm. A medium has a thickness of 0.2 mm. So this is all you have to remember. Now this is the rubber dam sheet you can see all around. So this is the rubber dam sheet, and this area is the rubber dam clamp. So it is tied with help of a dental floss. So this is dental floss and it is tied with the help of dental floss. So this is the rubber dam clamp. What is the purpose of this rubber dam clamps? It tends to hold the teeth. So this rubber dam clamp will hold the teeth. We tie a floss to it. This area you can see is the bow area of the rubber dam clamp. This area, and there is a hole where you can attach a dental floss to it. These are its jaw and these are its prongs. So remember, so these clamps should contact teeth from all the side. Remember, a clamp should contact teeth from all the sides. Now this is important for your exams. Various clamps and tooth type. This is ivory W212. 212 is used for anterior teeth. Ivory W2 is used for premolars. Ivory W8 for maxillary molars. W7 for mandibular molars and W56 for most of the molars. So this is important for your exam. Now moving to the question, which part of rubber dam sheet is generally placed facing the occlusal side of the isolated teeth? Now we discussed that the dull part is less reflective. So it is placed on the occlusal side or toward the operator side of the isolated teeth. So your answer will be dull part. Now next question, which is more effective in retracting tissue and more resistance to tearing? So it is a thicker rubber dam that is more effective in retracting the tissue and more resistance to tearing. So answer will be thicker. Now we discussed that rubber dam clamp consists of 4 prongs, 2 jaws connected by a bow. Now let us see, these are the 4 prongs you can see at the 4 corners of the tooth, and these blue are the 2 jaws that can be seen, and these prongs and jaws are connected by this green bow. Now we discussed that there should be a 4-point contact. So why we need a 4-point contact? That prevents rocking or tilting of the retainer. So movement of the retainer or clasp on the anchored tooth that may injure the gingiva and the tooth, resulting in post-operative soreness or sensitivity. Now these rubber dam clamps can be with wings or without wings. Now you can clearly see this 18 number is showing no wings, and this is with wings. Now the wings are designed to provide extra retraction of the rubber dam from the operating field. Now the bow of retainer which is applied after rubber dam is in place should be tied with a dental floss of how much length? it should be 30 centimeter in length. So remember it for your remember this for your MCQ exams. Now other MCQ that can be asked is retainers with serrated jaws. Is it is tiger clamps? Yes. So the stabilization of broken down teeth can be done by this retainers with serrated jaw. One of them is tiger's clamp. Now this is SG Silker Glickman clamp. So it has a anterior extension that allows the retraction of them around several broken down teeth. So this is the anterior extension. So the clamp is placed on tooth proximal to one being treated. So the clamp, you can see, this is the tooth we have to treat, and the clamp we are placing on the proximal tooth. What are the method of tying a retainer with a dental floss? Now you can see these 4 types of tying retainer with the dental floss. So these are the 4 methods of tying retainer with the dental floss. Now next we are going to discuss is a rubber dam frame. Now rubber dam frame supports the edge of the rubber dam. Now various types of rubber dam frame, let us discuss them. Type A, it is called as Young frame. It is U-shaped and made up of metal. So it is made up of metal, and since it is made up of metal, it will interfere with the X-ray that will cause obscuring of important structures in the radiograph. Now next is the Starvici frame. So it is a U-shaped frame made from radiolucent plastic and nylon material. It is regarded as suitable substitute for the Young's frame. So you can get one image based question asking from which is this type frame. It is Starvici frame. Next is the Nygaard Osby frame. It is type C frame. It is made from radiolucent plastic and nylon material, and it can be left inside the patient mouth while taking radiograph without obstruction in the radiograph. So this is the Nygaard Osby frame. Safety frame. So when a taut rubber dam sheet exerts too much pressure on the rubber dam clamps, so they cause them to come loose, especially clamps attached to the molars. To overcome this, a designed frame known as safety frame was developed. Because of its snap shut design, it takes advantage of clamping effect on the sheet. So you have to remember this safety frame. Now punches. Now rubber dam punch is a precision instrument having a rotating metal. So this is the metal table disc with a plunger. This is the sharp pointed plunger, and these are the various holes you can see. Now rubber dam punch is used to make holes in the rubber dam sheet through which teeth can be isolated. Now you can see these different holes. The bigger hole is for the molar tooth, whereas smaller tooth for the anterior tooth, these are the smaller holes. Rubber dam template. This is the rubber dam template. It is an inked rubber stamp which helps in marking the dots on sheet according to the position of the tooth. The rubber dam accessories, lubricant or petroleum jelly can be applied under the surface of the dam. It is helpful when the rubber dam sheet is being applied to the teeth. Dental floss can be used. They are used as flashing agent for rubber dam in tight contact areas, or wet jets can be. Sometimes wet jets are required to support the rubber dam. Rubber dam napkins can be used. It is a sheet of absorbent materials usually placed between the rubber dam sheets and soft tissues. recent modification in the design of the rubber dam. The first is the Insti dam. So it is recently introduced disposable rubber dam for quick convenient rubber dam isolation. It is natural latex dam with pre-punched hole. So you can clearly see this pre-punched hole. This is Insti dam. So if you get a image based pic asking which rubber dam is this, it is Insti dam. Important feature of this is radiograph may be taken without removing the dam. Next comes the handy dam. It is pre-framed rubber dam that eliminates the need for traditional frame. So this is the handy dam.
Discussing the MCQ with you. The thickness of rubber dam for children is, well, the thickness of rubber dam for the children is 5 into 5 inches. It is for the children's, and 6 into 6 inches it is for the adults. So your answer will 5 into 5 inches. Now we discuss we discuss the thickness of rubber dam sheet that can be thin, medium, heavy, extra heavy, or special. Again, you have to remember this for entrance exam. Now, Rubber dam was introduced by S.C. Barnum, a New York dentist, in 1863. Next question: the most effective method of maintaining dry field in dentistry is? Yes, rubber dam is the gold standard. So your answer will be rubber dam. Instrument used for gingival retraction during rubber dam placement is, we use retainer number 212. Let us see what is this retainer number 212. It is used in class 5 cases. So this is the retainer 212. The main disadvantage of using wing shaped rubber dam retainer is it interferes with the placement of the matrix band. The thickness of thin rubber dam is, it is in 0.006 inches. The rubber dam recommended for maxillary tooth is, so from the table it is W8, and ivory 212 for the anterior teeth, W2 for the premolars, W7 for the mandibular molars, and W56 for most of the molars. So W7 is for mandibular, W8 is for the maxillary molars, and W2 is for premolars. The distance between two holes in the rubber dam sheet is the distance ideally should be 6.3 mm. Which of following is not true about lubricant for rubber dam placement? We don't use Vaseline as a lubricant. Remember, we use petroleum jelly. We use cocoa butter or petroleum jelly. Now, when removing a rubber dam, the first step is to cut the interseptal rubber with scissors. Now, this is the figure showing cutting the interseptal rubber with the help of scissors. So, when you have to remove the rubber dam, this is your first step. So, steps for removal of rubber dam: cutting the interseptal rubber, removing the retainer, and removing the rubber dam. Discussing the rubber dam placements technique. The first step is the testing and the lubricating the proximal contacts. The operator receives the dental floss from the assistant to test the interproximal
contacts that removes the debris from teeth to be isolated. Using a wax dental floss may lubricate tight contact to facilitate dam placement. Step Next step is punching holes. It is recommended that the assistant punch the holes after assessing the arch form and tooth alignment. So, pre-punch the dam using holes marked by template or a rubber dam stamp. Third step is lubricating the rubber dam. Lubricates both sides of the rubber dam that facilitates passing the rubber dam through the tight contacts. Select the appropriate retainer and testing the retainer stability and the retention. There should be 4-point contact as discussed before. Position the dam over the retainer. So before applying the rubber dam, a flow of tight may be threaded over the anchor hole. So before applying the dam, a flow may be tied to the clamp. Now passing the septa through the contacts with the dental floss. You can clearly see. And next step is the inverting the dam, applying wedges and check for the access and the visibility.